Hi everyone, I would like to welcome Dr. Terry Lynn to this episode of the Barry Chronicles. I am your host, Damo. Dr. Terry Lynn, welcome to another episode of the Barry Chronicles. Dr. Terry Lynn, thank you so much for coming on to another episode of the Barry Chronicles. We are so happy to have you here tonight. Recently, we've had a lot of discussion on our groups about supplements after bariatric surgery, and in particular, the age-old topic of multivitamins and sort of where they stand and, what is best for people. But I know that you've been involved in a couple of papers and some news articles recently. And I thought, who better to ask than someone who has the experience of a dietitian and also a general practitioner, which I think is amazing. So, Dr. Terry Lynn, where do we start after we have bariatric surgery and our doctor says, you need to take a multivitamin?
Look, I think that in general, I agree with that blanket statement that people who've had bariatric surgery need, in general, to have some sort of supplementation. So I agree with that blanket statement. But the nuances are that what that supplement is will be different for individuals, different for what type of bariatric surgery they've had, but also individual differences. So I could say to you, so for example, sleeve gastrectomy, the ones that I worry about are B12, iron, and vitamin D. But I have had some patients who amaze me to say that they're not taking, a regular multivitamin and mineral, and I expect their bloods to be extremely deficient, and they're not. So I do think that 100% the international guidelines are that everyone who has surgery should be on a minimum basic multivitamin and mineral regime, and that might be more than one tablet. But then we need to actually find out how that individual is going. And the only way that you can do that is with regular blood tests. So I think the good surgeons, when they're talking to patients who are thinking about bariatric surgery, part of that informed consent process is a commitment to having regular blood tests. And depending on what surgery you have, but as a minimum, it'd be initially in the first 12 months, 3 months, 6 months, 12 months, but then at least 6 to 12 monthly lifelong.
Yeah, I guess I had my sleeve before a lot of these things were really well known, and my surgeon did sort of say, oh, you might need a multivitamin after you have your surgery, but it was nothing that was ever really, this is important and this is why it's important. And I think now with so much changing, and we've sort of seen it, the pendulum sort of swing to the blanket, everyone needs this multivitamin and, take it religiously. But I love that there's more focus on the individual and what they need. And that's what we're definitely seeing is people that are coming out saying, look, I've been taking my multivitamin, I've been taking my supplement, whatever it is. And now I'm finding that some of my vitamin levels are getting a little bit too high. And that's causing other issues, isn't it?
Yeah, that's right. I think the first thing for people to understand is that when they do their blood test, they need to make sure that they haven't taken their vitamin and mineral supplementation just prior to their blood test. So I feel as though certainly in some of my patients, we might have got a false reading of excessively high levels because they took their usual, multivitamins, minerals and medications prior to their fasting blood test. And previously I would have said that, yes, fasting means no food, but water, can't have tea or coffee and take your usual, medications. But particularly around those serum levels of multivitamins, minerals, we need to make sure that you haven't had them the morning of the day that you have them, or if people take them at night, that's usually okay. But we do want what we call a trough level, as opposed to having them and then a few hours later you're having your bloods drawn. So I do think it's really important that if we're going to be doing testing, we do it to get the the true level of those blood vitamins and minerals. So that's one point. And the other point is yes, it is very individual with regards to the surgery type, individual into where people are, how many years post surgery, and individual with regards to what people are eating, and how how they're sourcing some of those important nutrients. But also individual needs as well, and definitely what type of vitamin and mineral preparation they're having. So brands do actually make a difference. And I think, like you said, Amo, that that it wasn't such a big thing when you had your surgery, but very quickly it is now. And that's because it's based on research. So there's a lot more research about these nutritional issues and a lot more international guidelines to give us an idea of what would be considered best practice.
Yeah. So what are some of the issues that people are seeing? I mean, the big one, which is in the media quite regularly now, I guess, is B6. And
Yeah.
what are some of the issues that people are seeing from excess levels of B6?
So why I think B6 in particular has really grabbed the attention of the Australian media and Australian public is B6 is what you would call a water-soluble vitamin. So the sort of truth that we thought was out there until recently was, oh, you can't overdose on a water-soluble vitamin. You just wee it out, But this is actually one example of where that knowledge or truth as what we thought was proven to be incorrect. And it's actually quite a complex and fascinating story, is that the reason that we're starting to see problems with B6 includes not just the high doses that have been allowed to come into Australia, but the particular type of B6 product, which meant it had a longer half-life, which meant that it was hanging around in our system longer than, say, the European products. And then they're understanding only relatively recently that excess B6 can be causes of something called peripheral neuropathy.
Yeah, which, I mean, that's something that I suffer from, and it at times can almost be crippling, especially when my foot is completely numb and I'm walking on uneven ground and suddenly I'm no longer walking, I'm falling. And then there's all the issues that come along with that. And I guess people may not necessarily even know what's causing it.
That's right. So two things that I'd like to reflect on that is what I find, and it does my head in, peripheral neuropathy associated with vitamin B6. You can have it if you're deficient in B6, and you can have the same peripheral neuropathy symptoms if you have, B6.
Damned if you do, damned if you don't.
Exactly, right? And then the other thing that I think is really important is peripheral neuropathy can be caused by so many things. And sometimes I do think that, it might be a number of different causes for an individual. But one thing that, we can do, we may not be able to reverse the nerve damage from diabetes, but if we do look for causes that are easily reversible, such as taking a supplement that has excessive sources of B6 and proving that the serum levels are high, if we catch it early enough, that particular cause of peripheral neuropathy can be caught in the bud early.
Wow. And I really find the science behind it interesting, because we can sort of look at all the multivitamins and different supplements, but it can also be in just over-the-counter general product, like some drinks, different foods. I was on a parenting site where they were talking about an overseas purchased melatonin, which had crazy levels of B6 in it. And people were saying that their children had been experiencing neuropathy.
Yeah.
When they started looking, they found, I think one of them had almost 50 milligrams of B6 per tablet.
Goodness me.
And I was like, no wonder these kids are suffering from all these aches and pains or whatever it is. And, it just really blew my mind. And I sort of went on a bit of a deep dive then, looking at different things. I mean, obvious one, Red Bull has quite high levels, and different energy drinks like that. Why do they put so much of these vitamins in these products?
Yeah, so need to understand that we have two completely different regulatory systems. So you've got FSANZ, which stands for Food Australia Standards, something or other, Food Standards Australia and New Zealand. So that's the legal and public health representation about what supplements or supplementation is in food, so food and beverages and those sorts of things. And that is a completely different body from regulating vitamin and mineral preparation. And so that's part of the reason why there is a concern, is because it's not just people, in general, people can't overdose on vitamin B6 if they just eat normal food, all right, as in, unprocessed, normal food. Having said that, even within some of our, breads and cereals, which I'd call, normal foods, there has been some supplementation in B6, but it's much, much less doses than what you would see in what I'd call a highly processed energy drink, or formula or muscle growth protein powder, those sorts of things. And then the next level up, again, so for example, the highest level in a food product is regulated to be 10 grams. So the Red Bull example that you gave, in food, you're not allowed to put more than 10 grams of B6 in a serving of food / drink. And Red Bull would be the highest one currently on the market. Whereas in a chemist at the moment, you can get a supplement that has up to 50 milligrams of vitamin B6. And you may even not know that it has B6 in it because you're buying it because it says magnesium on it. Executive stress, B vitamin complex. So you think you're actually taking a zinc supplement. But looking in the fine print, there'll be B6. And you might not even recognise it as B6 because it'll be called pyridoxine or pyridoxal or these sorts of things. And so there's multiple reasons why it's been so hard to actually see how big this potential problem is, because it's in what I'd call normal healthy food, then it's in some of those energy drinks or protein powders, and then it's in the supplements that you not even think they would have it in there. And that's where it's that cumulative effect of those products. Even something like Barocca, or people take to want to feel better. If they're taking a relatively small amount, so less than 10 milligrams, but they're having multiple sources, and most days of the week it can really increase. And the other concern was we thought that symptoms of peripheral neuropathy was happening only when people were having like 100 grams, for example, or 200 grams. But some people are having symptoms as low as 50 grams. And this is where a lot of advocacy has come from the dietitian and medical community to lower the limits of these products for the safety of our general public.
Yeah. So do you find that people that have had a form of weight loss surgery, does this affect them even more than your general public?
I don't know if it does. What I feel is it was certainly in the bariatric community that I think we first saw this, because it was in the bariatric community that we were testing. I feel as though there could be a lot of, a lot of people out there that have no idea. And so although the bariatric community would be the community that is being told to take multivitamins and minerals, in general, they're getting quality advice, which is which vitamin and mineral, right? As opposed to, being not having any advice at all, but going to the pharmacy and getting a sleep aid at night or a magnesium, muscle cramp relief, or like you said, the melatonin or something like that. So I don't necessarily think the risk is high because the bariatric community are being advised to take a multivitamin mineral. In general, that advice is, appropriate, particularly the bariatric specific. I think it's all of the unregulated, unadvised things that are happening, whether you have had surgery or not. So, yeah, in that energy drinks, in those things that you think you're just getting zinc or magnesium or melatonin, but it's coming with friends.
Yeah, it's amazing because I know I've even been guilty of it in the past. You're going to have a big day ahead, and I've thrown my multivitamins down with my Red Bull and just let's do this. And you don't realize that you're double, triple dosing on some of these vitamins that could be causing issues as they build up in your system.
That's right. And the marketing is so seductive. got a teenage son, who's a gym rat, and his gym bros, and he takes his, his pre and his
Yeah.
post. That no
Keratin
idea.
and everything else, and
That's right.
you're not taking the right one. Suddenly you got
That's exactly right. And he gets his energy drink on his way to school. And yes, I say sometimes I have no idea what he's taking. And the concern is it's not just one product; it's multiple.
yeah. Wow. I mean, as a just a sort of lay person, I look at it and think that there really needs to be something done about it. Maybe a little bit more than just on the education scale, because from what I see, a lot of people struggle with reading labels. Because I mean, honestly, if you see something in the fridge at the survey, you think it's okay to grab it out and drink it or eat it or whatever it is. And, you don't not sort of sitting there going, do I need to add up what I had for breakfast? Most people don't do that.
Yeah, yeah, absolutely. And that's where that independent review was looking at multiple different ways to try and tackle the problem. But I think it is hard where you not only have to talk to the food standards people, you also have to talk to the supplements people, and put in, checks and balances. In the most recent report, I think they said that if they're wanting to change the maximal dose of B6 people can buy off the shelf, right, in the chemist or the
Yeah.
Coles or whatever. And they want to say that, if it's more than 50 milligrams in a tablet for a supplement, then it needs to be, behind the chemist. You need to have talked to a pharmacist about it. So there is that interaction there. But, some people are suggesting that, that's not a, that, it needs to be more than that, because that's not just the one source that people are being exposed to.
Yeah. And I know that that was definitely the case for me and other people that I know. Even at one point, there was some medications that a family member was taking. And, I was just sort of curious and reading labels and stuff. And I'm like, you might be having too much B6 in some of these when they're all added together. And yeah, I mean, it creates some great conversations, but that's because I know a little bit about it. General public wouldn't sort of understand to add all these certain sources together and go, oh my goodness, I'm having 3 times what I should be having. You were involved in writing a paper, is that correct?
No, just in reviewing. So, as part of my representation role at the RACGP, when that independent body was sort of looking at all of the evidence and suggesting what they had recommended to change, they did ask the RACGP what they thought, and we supported it 100%. But there was over 100 products that if they brought in that ruling of anything over 50 milligrams, 100 products currently in Australia would have all of a sudden have to be taken off the shelves and put behind the chemist's desk.
Wow.
100 products.
Wow. That's a lot of money, isn't it?
It is. Yeah.
And I can imagine there'd be a lot of pushback over that.
Yes. Yeah, that's right. And like you said, Damien, since I think it was 2022 or 2023, the first sort of TGA mandated from the supplements point of view, not the food point of view, they had to put, the warning if it was greater than 50 milligrams. And most manufacturers, I believe, has been compliant about it. But putting that warning, contains vitamin B6, once it's above a certain level, like you said, you need more than that, right? You need more than just a warning contains vitamin B6. And that was what that independent report was saying, is that it's multiple levels of intervention, stricter warning labels,
Yeah.
as well as stricter when it is very high, with regards to prescription only if it's very high, so above 100 milligrams. That 50 to 100 is behind the chemist. You have to talk to someone. And again, we've even got, different health professional groups saying that even at the line in the sand of 50 milligrams is too much. But I do think that it's mainly the supplements that are the biggest cause, but it's more about not just having, one supplement. It's, supplement plus a Red Bull plus a Barocca plus a magnesium to help you get to sleep.
Yeah, it adds up very quickly.
Yeah, it does.
So, do you sort of know what the point of companies putting that much B6, for example, into, say, a Red Bull or a supplement into magnesium? Is it just a good filler, or is it, you know?
Yeah, I think that there was this, consideration that the B group vitamins, which are involved in energy metabolism, it was that's where, again, I think you and I are a similar age, but I remember it was, about taking, it was called executive stress B
Yes.
complex, right?
I used to take it.
Yeah, I remember that one. Right, and then the Barocca after having a night out on the town and these sorts of things is that to having that B complex vitamins, which is all of the B1s, right? B
Yeah.
vitamins, so B1, B2, like there's a whole heap of them, right? And the idea was, yes, you're going to deplete them if you're stressed or you have too much alcohol or this or that or whatever. And this is a way to feel better. So I feel as though a lot of it is really about marketing,
Yeah.
to be honest, and the assumption that, yes, they're water soluble. So, if you don't need them, then you just weed them out. So it's
Yep.
expensive weed. And so I think that, yes, we've been a little bit caught in that regards.
Yeah. I remember I used to do a live sound engineering, and there were times where, you'd be at a show and the suggestion was, take a couple of Barocca and it'll give you the energy you need, but if you don't need it, you just pee it out and you're good to go.
Yeah.
And I think that's where I sort of got into the whole, then it just became Red Bull because they were easier to buy, or cans of V or whatever it was. And I guess I didn't really hear about it until well after I'd had weight loss surgery, and I was actually at a conference listening to some dietitians talking about it. And then I thought, oh, well, it must be something that's specifically related to people that have had weight loss surgery, purely because that was the industry that I was listening to when I first heard about it. But obviously that's not the case either. It I don't know, I find it quite scary that we really don't know what we're putting into ourselves, and it's not through any fault of our own, but even the companies don't know the long-term effects of some of these products.
Yeah, that's right. And look, I think that's the difference between, say, prescription medications versus supplements. They're not held to the same standards of safety or standards of manufacturing, and proving that they work. And same with their risks. So yeah, out of all of the options there, prescribed pharmaceuticals, supplemented foodstuffs, and then vitamins and minerals. It's really those vitamins and mineral type supplements that have my biggest concern, because prescription medications are at the highest level of quality control, proving both that they work as well as their risks. Foods is limited at 10 milligrams, but it's really more from the supplement point of view, where there's a huge variation in what can be put in them.
Yeah. And I guess one of the hard things that I find is that even though I'm not a medical professional and I've never claimed to be, we're still limited and get nasty emails from people if I stand up and go, this is the multivitamin I take because of these reasons. We're not really allowed to talk about it.
Yeah,
And I find that really frustrating because there's people that would really benefit from knowing what a trusted brand is.
yeah,
Yet it's like we've all got this gag on us that, oh, yeah, there are brands that, might be better than others, but we can't mention it.
yeah, yeah. Look, I think the only way you can mention that is when you quote the research. And
Yeah.
there certainly are some brands that do publish, their results. And I think that's where you can have trust, because they've done the research. The research has been peer reviewed, and it's published to the general public. So there's nothing behind closed doors, and it's not just claims. There's some appropriate research level evidence behind it.
Yeah. And that's a great thought actually. And I might look into getting some of that so that we can make that available to especially our members in our groups so that they can sort of buy with a bit more confidence.
Yeah, absolutely. Even if we took, and I can email you later, what the international recommendations of, if you had like you want to make your own multivitamin, they've got a list of what they say is, minimum versus, ideal. And then you could put up your particular brand and compare it to, what is recommended. You don't necessarily need to feel that you're being boxed into only buy these brands because they've been proven. It's like, well, no, make the work, make it easy for yourself. These brands have been proven, but if you want to compare brand XYZ, this is what the ideal best practice would be. How does it compare to that?
Yeah. Yeah, and the TGA does offer some advice on different brands as well, doesn't it? Like if they've had any issues in the past, you can look that up on the TGA and find some of that information for yourself, which I think is fantastic. Just sort of keeps everyone a little bit more honest.
Yeah, and look, I think it's overwhelming, right? If we mentioned that there's over 100 different supplements that had that greater than 50 milligrams of vitamin B6. I don't have 100 supplements in my head, all right?
No, I can't even really think of 100 different supplements. And then, but obviously there is a chance that people are on multiple of those ones. And
yes,
that's sort of scary.
It is. And that's where, we were talking about they take their magnesium for their sleep and they take their zinc for their skin, for example, and they might take B3 for something else. And little do they know that B6 is in all of those things, and the B6 has been called different things.
Yeah, and I think that's the big thing because, I know I've sort of scanned through different bottles just looking for B6, not particularly looking for, what's this huge word that I can't pronounce? And, because, that takes work, doesn't it? You don't want to be standing in the shopping centre punching into Google these different words to try and work out what things are.
Yeah, and look, to be honest, when I talk to my patients, most of them will, see what's on special. I do that myself, right? I take omega-3 for my small joint arthritis, and I'll see what's on special when I'm doing my Coles online shop, and I'll get that brand for that particular month.
We've got to, like, the cost of living is so high, and I don't blame people when they're looking for cheaper options because we've all got to do it at times. You'd like to think that if you're buying, especially a supplement or a multivitamin off the shelf, that that there's been some sort of rules and checks and balances put in place that you're not going to do damage to yourself by taking it.
Yeah, and basically there's always been rules, but we've all of a sudden found that those rules are set way too high.
Yeah. So is there a possibility that these rules are going to change, or is it sort of just in the discussion phase? And
yeah, look, so the first, I guess, rule change was in that 22-23, but there's been more concerns and that's not enough. So we had that independent review. They have put that out to public consultation, of which myself as part of the RACGP was involved in that, supported that. We're still waiting for that final recommendation to be published after public consultation. But in that report, it gave them manufacturers up to 18 months to comply. So, these things are quite slow, but we still also have a group of, advocates who are suggesting that even the independent recommendations are, are not enough. But I do think, time will tell. But yeah, it's very slow to see some of these things change.
Yeah. So, and I know it can be hard to share stories, but would there be any that could sort of give almost like a worst case scenario that you know of, that someone's been taking these and it's really affected them, sort of lifelong type thing?
The only couple that I have heard of is when other media people have interviewed me and they've had case studies where people have had severe symptoms, and certainly my understanding is yes, if it's prolonged, some of those symptoms can be irreversible. But I do think it's really hard for certainly older people. So the two that I'm thinking about, were sort of 65, 70. It's really hard to tease out how much of that peripheral neuropathy was only caused by high vitamin B6 levels, because there are so many causes that can contribute to peripheral neuropathy. So type 2 diabetes would be high on the list. Excessive alcohol intake would be high on the list. Potentially from other micronutrient deficiencies. So B2 is known particularly for peripheral neuropathy. So and B1. So there's just so many things. Even autoimmune conditions as well. And so I do think that yes, when people are at the older spectrum, they can gather a lot of chronic conditions that all could contribute. So that makes it a little bit harder. But yeah, the ones that really stick out to me with significant disability. So, like you said, living with chronic pain is so hard. Having any sort of muscle weakness. The one gentleman I was thinking of, he had peripheral neuropathy affecting his gait, but it may be too big a bow to draw to say it was only high levels of B6 that was causing his gait abnormality, for example.
Yeah. And I guess that's something that even with that, you have to look at the individual and what is actually going on, as a whole person, not just taking and, I guess picking the best ones for the story. It was like I read an article about someone who had taken GLP-1. The media made it sound awful. And, fair enough, happening to have a gallbladder removed isn't, the best thing that someone could go through. But I guess we know that with drastic weight loss, that is possible anyway. And there's a certain portion of the population that even without weight loss will end up having to have a gallbladder removed. So, sort of sensationalizing the GLP-1 story a little bit when, not taking into account all the factors. I guess that there is that possibility, which I suppose these committees have to look at that as well and balance it all out.
Yeah, that's right.
So if someone goes and has their bloods done and they find, yep, I've got high levels of B6, what is the treatment for that? Or is there a treatment? What do we do then?
Yeah, so we try and identify the source. And that's where, the most appropriate person for that would be a dietitian. And they go through, with a fine-tooth comb, all of those sources. Naturally occurring food sources would be unlikely to be a big contributor. But what about those food sources that may be supplemented? One of those high food sources, which are the energy drinks or the protein powders or those sorts of things. What might be the supplements that they're getting from the chemist, and not just multivitamin minerals, but those sleep aids or the muscle aids and those sorts of things. And then, sort of getting all of them together. So I remember with one of my patients, she had high vitamin B6, and we assumed that it was from her multivitamin mineral, which she stopped. But her levels weren't coming down. And I was like, where could this possibly be coming from? And I was, thinking, I think she was actually on a compounded injectable medication, and my concern was that they had added some sort of B complex in that injectable, and so I'm ringing the compound chemist, asking them what else is in there. But long story short, it ended up being, I think it was magnesium or zinc, which didn't come up in that first consultation. So I've learned from that, which is bring me absolutely everything that's in your medicine cabinet. I don't care what it is, just bring it. Yeah. And I literally go through it with a fine tooth comb, and then I start to think outside the box as well.
Yeah, I mean, with our mum going through her health issues over the last year, we ended up just all her medications were in one bag, and if we took it to emergency or wherever we had to take her, that bag went as well, so they could sit there and look at everything that she was taking, so they could get the full picture.
Yeah, look, I love going through what people are taking, because I'll write down the little list, and then I'll say, well, why are you taking X, Y, and Z? And they'll sort of look at me and go, I don't know, I just thought it was good for me, or I just heard about it, or my friend was on it, or this or that, and that sort of stuff. And I just think it's really important for people to understand that just because something might be natural or found, in food in the natural environment, doesn't necessarily mean that it's not without risk. And I think it's really important that to understand this term that we call nutraceuticals. So it's taking a nutrient that might be found in normal, food or environment, but when you put it into a pill or a potion, it's concentrated in such amounts it's acting like a pharmaceutical, acting like a drug. So that's why we call it a nutrient-crossed pharmaceutical, a nutraceutical. And a lot of these supplements, really, you would never get that amount. So let me contrast what the recommended daily intake of B6 is for most adults. It's between 1.3 and 1.7. So 1 to 2 milligrams. And we're talking about 10 milligrams being in one can of Red Bull, or up to 50 milligrams being in a magnesium supplement that you didn't even know that it had B6 in it.
Yeah. I mean, I guess the first time I ever saw anything like that was when I was a kid, and you'd have those vitamin C orange flavored tablets, and they do, however many times the
Yes.
RDI, and that's when it sort of started for me, I guess. I remember my grandmother saying, "Oh, it doesn't matter, whatever your body doesn't use, you just pee it out."
Exactly.
And so I just thought, oh well, that's what happens with the vitamins, and it sort of came from that early age, which I guess Nan wasn't completely wrong, but as we learn and more research, and these things aren't necessarily true just because that's what was said years ago. It probably would have been fine to eat 3 oranges.
Yes.
It's a bit different when you put all that into one tiny little tablet.
And I remember from my childhood, I liked the taste of those things, right? They were almost like lollies, and I could sneak an extra 1 or 2 of them in. And we do know that particularly very high doses of vitamin C. So we're talking sort of 2 milligrams. Yes, you pee it out, but on the way you pee it out, it can increase your risk of kidney stone.
Wow. Okay, that's interesting. 'Cause, hey, juices are very popular now. We see so many people, and they have juice diets. I was actually contacted a little while ago asking if I would like to try this juice diet, and I was like, no, thank you. Just because, no. There's the sugars, and okay, they're natural sugars, but it still can affect your diabetes and all this sort of stuff. We have to be careful, just because like you say, just because something might be natural, but then when it's taken from its natural form and put into something else, then those things can concentrate and change, and we don't know what else has been put in with them.
Yeah, that's right. I agree 100%. You're talking about juice, and we say it's natural because it comes from fruit, which is natural. But if you think about in caveman days, we didn't drink juice, right? Because we didn't have 10 oranges to make the juice from, right? If they did actually eat an orange, it was just 1 orange, sucking the juice out of it. But if you think about the orange juice concentrates, that's 10 oranges just to make one drink.
Yeah.
And that would not be normal back in the days where, we were hunters and gatherers.
Yeah, well, I mean, I learnt the hard way with that. When I was a kid, we drove from the Sunshine Coast up to Cairns, and it was in summer and it was hot, and Mum and Dad had packed an esky with drinks and all that sort of stuff, and I was just little and had the esky near me and drank a 6-pack of orange juice on our way, and the pain and diarrhea that I had that night. And Mum said to me, what have you been having? And she looked and she's like, you drank 6. And I learned then that, sometimes you can have too much of a good thing.
Absolutely.
So I think this is a really important discussion, and I'm so grateful for your time in talking about this, I think, because it's not all just cut and dry, is it? We can't just sort of I've had people say, but I'm taking these multivitamins that have been, that I was told I should take. Maybe it's not necessarily the multivitamin. We need to have our team, our dietitian, look at the whole picture of what we're taking and see if we can come up with solutions from that, because it'd be terrible to sort of reduce or cut something out of our diet and nothing changes.
Yeah, I'd hate to throw the baby out with the bathwater, like particularly in the bariatric surgery population, you do, I think, need to have some sort of supplementation. And then I'd hate for people to be scared of taking a multivitamin because they're overdosing on B6. I think it's about having the appropriate supplementation regime for individuals.
Yeah, no, I think that's great. Thank you so much for your time tonight.
You're
This has
welcome.
been fantastic, and I can't wait to do this again.
Yeah, I love it. It's always fun.
Yeah, it is. Thank you so much.
Thank you. Bye now.